I'm Sandy Collier with this T. Leroy Jefferson Medical Society special report on COVID. We all want to be done with COVID, but the truth is, COVID is not done with us. For the next 30 minutes, we will hear from this group of healthcare professionals, all on the front line of this pandemic. They are all members of the T. Leroy Jefferson Medical Society, an organization of doctors and healthcare providers committed to providing services for the community, for the underserved and the underprivileged in our community. Joining me are infectious disease specialist and head of the T. Leroy Jefferson Medical Society's COVID-19 Task Force, Dr. Kitanga Camino, and infectious disease specialist, Dr. Joseph Etienne, and infectious disease specialist, nurse practitioner, Rashawn McCray. Well, thank you guys all for joining me. This is going to be a wonderful discussion, but before we start, what's the society's message?
Well, the first message is masking.
The second message is testing.
The third message is boosting.
Okay, well, that's pretty simple. But, you know, realistically, we still see people not masking right now. Everybody thinks COVID is done and it's over with. Are we really, like, done with COVID?
COVID is still there with us, unfortunately. As a matter of fact, right now in the United States, we have the Omicron BA.2.12. So 100% of the cases in the United States are of the Omicron subvariant. The good thing is with the Omicron virus is the fact that it's not as lethal as the Delta variant. However, the bad thing with it is it's very contagious. So for each person who gets that virus, it has the potential to infect more people than the Delta variant. Now, it's not only in the United States, but also in South Florida, where it's hot. I don't see anybody wearing any masks. So, as a matter of perspective, right now we are testing in Florida, in South Florida, 19% of the tests are coming back positive. And this is an undervalued number because most people who are testing are actually testing at home. So we don't even catch all those people who are testing positive at home and are staying home. So that 19% might be a much lower number than what really is going on in our community. So COVID is there, COVID is alive. So that's where we are with COVID in 2022, unfortunately. Now, the other aspect with the COVID, now we're saying, well, not too many people are dying, so what's the big deal? So as we are getting more COVID cases, we are also seeing more variants, and we are afraid that those new variants may not be as responsive to the vaccine that we have. So that's why our message remains the same: mask, boost, and vaccinate. So that's where we are.
What, for people out there that haven't masked up, or people out there that haven't gotten a vaccine, or people that don't believe that they need a vaccine, what do you say to them right now?
So I think what we have been saying all along, even though the disease is not as deadly, but it's still very contagious. It may not be deadly for the young person, but unfortunately, the people who are dying more of the disease are going to be the underrepresented minorities, and also our older population, our grandparents, and our parents. So as a matter of fact, most of the cases of death reported by the CDC are among the 80 plus, and also, unfortunately, the underrepresented minorities, Hispanic, blacks, and so forth.
What do you guys see? What do you say to your patients when, or people in the community that just don't want to mask and don't want to test and don't want to boost?
Right, so we feel that masking is actually the simplest strategy to prevent COVID transmission from person to person. We know that it works, we know that it's safe, and we know that it's effective, and we ensure people to do it as much as possible because, as Dr. Etienne pointed out, we still have COVID in our community.
And Nurse Practitioner McCray, what are you seeing? What are you saying to people?
What I say to people when I see them coming to the hospital, I tell them how important it is to continue to mass test and boost, because you just never know. You can't trust anyone. You don't know if someone's sick or they just coughing. You don't know, it could be COVID. A lot of people might say it's their sinuses, but it could be COVID. You sure have to test to make sure, rule that out first. If you're feeling a headache, make sure you test and rule COVID out before you spread it to anyone else. So my take on this, always test first before you go out and spread it to someone else that you might love or even a friend.
More than 1 million people died during COVID so far, and I had an opportunity to sit down with a funeral director who told me that she embalmed over 200 bodies. Then she contracted COVID, and she said she was so sick, she planned her own funeral. For Libby Santos, the dead became her life.
After I did the very first remains, and we embalmed them, cosmetized them, casketed them back then in the 1980s, the early 80s, I was hooked.
She worked as a licensed funeral director until COVID. As a funeral director, you have embalmed lots and lots of COVID cases. So let's talk about when the pandemic started and you're embalming all these bodies. What went through your mind?
I was heartbroken about the fact that so many families were unable to see their loved ones. So I was very passionate about allowing families to see their loved ones and have that closure.
Christmas 2020, a moment she'll never forget.
On December 24th, I embalmed my last body. On December 25th, I had Christmas dinner with my family. So Christmas Day, my daughter, who was a critical care nurse at Broward Health, arrived with a bad headache, not feeling well. And by the day after Christmas, I woke up and I also had a headache and a high fever. And the next day she went and got tested. She was positive with COVID. Her symptoms weren't very bad. My symptoms got exacerbated very quickly. And by January 2nd, I was in the hospital, and I stayed in the hospital for 7 weeks.
As a breast cancer survivor, Libby had a weakened immune system.
I believe that was the major factor in my decline with COVID. Everybody else seemed to get through it. For me, it was just difficult.
Tell me about your funeral director. So that must have been going through your mind. Oh my God, I embalm people. Is this reaching to near the end for me?
It was very, very much in the forefront of my mind. On the way to the hospital, I was giving instructions to both of my daughters. This is who's to embalm me. This is where I want my services. And they both were telling me, stop, please don't talk like that. I knew what I wanted done, and I really felt that that was it. I was ready to go home. You know, it was my homecoming. So I was ready for that. I was going home.
And you were planning it.
I was planning it on
But
that
God
drive.
had other plans.
God had other plans.
Libby recovered, but there still are bad days, including another run with COVID.
A bad day is when I cannot walk from my car to the inside of the house without choking and gasping for air.
So were you vaccinated? Did you get vaccinated?
Absolutely.
Okay.
Absolutely.
What do you have to say to folks now who say, oh, I'm not getting vaccinated. Oh, forget that. That's not going to happen.
This is what I have to say. We live in the most progressive country in the world. We know that vaccinations save lives. We vaccinate our babies, right? However, if we had a foolproof vaccination that would stop this virus, we would all line up for it. Unfortunately, the vaccination became politicized.
Dr. Gomino, there are thousands of stories out there just like this funeral director's story. And there's so much more to learn about COVID, new treatments and therapies and testing. What's the latest?
Well, thank you very much, Sandy, for this opportunity to talk to this panel. So I feel the best way to illustrate what we have with COVID when it comes to testing and treatment is to just give you a typical case scenario that we've had. So let me start by saying we had a 65-year-old gentleman with a history of hypertension who was actually vaccinated and boosted against COVID, who decided to go on a cruise trip with friends, like so many people are now doing. And upon returning from his cruise, within a couple of days, started experiencing some shortness of breath, some dry cough, and even some low-grade fevers. And so he actually went on the recommendation of his doctor and got a rapid COVID test, which was actually positive. So we got a call from his doctor as to what would be the best treatment option for this gentleman given his symptoms. However, the story doesn't end there. This man actually lives with his daughter, who happened to be 6 months pregnant. His daughter is unvaccinated, and when she first heard about her father having a positive COVID test, she too went out and got a rapid COVID test, which was actually negative. However, over the next day or so, on the recommendation from her doctor, she went ahead and repeated the test, but this time she got a PCR test, and that actually came back positive. So given this clinical scenario, I thought it'd be best to now talk briefly about what those tests mean, because from time to time there's been confusion. And so a rapid COVID test is a nasal swab test that is done and is easily resulted within 15 to 30 minutes. It's a test that can be done quite easily and is quite effective when patients are actually most symptomatic, which means that when you're actually sick from COVID, the chances of having a positive rapid test are high. The problem is, as we saw with the pregnant woman, if you check a rapid test too early in your infection, then there's a chance that it'll be negative. Now, alternatively, a PCR test is actually a much better test because it's actually more sensitive. And it's more sensitive because it's actually checking for the actual genetic material of the virus itself. And by being more sensitive, you are more likely to have a more positive test. And we actually use it when we want to confirm a positive COVID infection or when we have a rapid test whose results we don't believe are completely reliable. So in this case, we have a 65-year-old gentleman with high blood pressure who tested positive by a rapid test. And we have his daughter, who's pregnant, who also tested positive by a PCR test. Bottom line is, both of them needed to be treated. And luckily, they were not sick enough to go to the hospital. So what do we have available for everyone in 2022? As of this month, in late June, we do have an oral antiviral medication called nirmatrelvir and ritonavir, which is a combination pill best known by its term Paxlovid. And Paxlovid is a pill. You take 3 of them in the morning and 3 again in the evening, and you take it for 5 days. This medication has been shown to improve patients' outcome. It's been shown to reduce the risk of people with COVID from developing complications from their infection. And this is a drug that can be safely taken. It has to be prescribed by your physician or your healthcare worker because it can interact with some of your blood pressure medications along with other medications. Now, in this case, the older gentleman was able to take this medication for 5 days, and he was able to successfully keep himself out of the hospital. And as far as his daughter goes, she too was able to take the Paxlovid, and it too was able to prevent her from suffering any complications, and she was able to stay out of the hospital as well. Now, for those who cannot take this new drug Paxlovid, there is a second antiviral out there by the name of Molnupiravir, which can only be taken in adults over the age of 18, and there has to be no evidence or any positive pregnancy test in the person who's taking the medication, because it has shown to have some side effects. But more practically speaking, if someone cannot take these oral antiviral medications, the next best option is a monoclonal antibody infusion. We have had monoclonal antibodies products available during the course of the COVID pandemic. And currently, the only one available to us that has shown to be effective against the Omicron variants is the bebtelovimab infusion, which is a one-time IV infusion that will also reduce the risk of developing further complications from COVID. There are two other products that are available. One is an IV antiviral medication that has to be given once a day for 3 days, and there is also plasma that can be given to patients. However, these last two options are not as readily available. So again, the key point here is to remember that we do have an oral medication available for people who do test positive for COVID and are at high risk for developing COVID complications that would lead them to go to the hospital. So please remember to ask your doctor or your healthcare provider about access to these medications, including Paxlovid and the monoclonal infusion bebtelovimab.
I spoke to a local businessman who had COVID twice, and the first time he told me he thought it was over. A staple in Riviera Beach and at the Super Bowl, McCrae's Backyard Barbecue and Seafood owner, Derek McCrae, thought game over when he came down with COVID. Let's talk about the first time, because the first time I remember you telling me that, oh my God, Sandy, I thought this was it. I thought I was going to see my master.
Yeah, well, I thought I had seen it. I was there, you know, but I guess they made a decision to send me back because I was definitely there, and that was one of the worst experiences I ever had with the sickness.
Doctors told him to go home.
The actual ailment, it was horrible. It felt like a demonic experience. I never wanted to experience that again.
But he would after a family gathering.
And I'm going to take blame for that because I didn't mask up. I left myself vulnerable to it. But the blessing was that all those shots that I had taken, the treatments, the two vaccines and the booster, kind of helped me from going into it really, really bad.
A monoclonal shot and pills followed. Time in a hyperbaric chamber helped build a defense too.
And I did about 4 or 5 treatments of the hyperbaric chamber, and that kind of brought me back to life.
He wants to go back to keep getting stronger, and he has a message.
Those who don't believe it, they're crazy. That was just keep it 100, because if you don't see what's happening, then something got to be wrong with you. But then you know what happens, the ironic thing, as soon as they get it, then they all jump on board. Then you got that COVID jump on your behind, then you want to hurry up and go figure out what's going on. So believe that COVID is real.
And Derek says that he's still dealing with long haulers. So I'm hearing that from so many people that have had COVID. So what is long hauler?
Long hauler COVID is different from each person. You can have fatigue. You can also have what we call brain fog, as well as joint pain. And some people still have a chronic cough, as well as probably loss of taste and smell. Sometimes it takes weeks or months before you get your taste or smell back, as well as continue with a cough. At this time, there's no treatment for long haulers COVID. I know a nurse practitioner, a friend of mine that has COVID, and she's still dealing with the long haul COVID symptoms. Sometimes she tells me when she gets out of her car, she feels so short of breath just coming from the parking lot to the office. But she's been dealing with this for over a year. But from day to day, she don't know how she go react. The next day, for a week, she'll be fine, but the next week, she'll be still short of breath. So everybody have different symptoms with this long hauler COVID.
So how do they, and anybody can answer this, how do you cope with it? What do you do?
So for most people, it depends on their symptoms, as Ms. McRae said. So is symptoms relief. There are some other modalities of treatment, as you stated. Some people do the hyperbaric chambers, some people do other medication, but it's really based on the symptoms that the person is dealing with, and a lot of reassurance, and then trying to listen to the patient to tell them that it will get better.
And do you think it will get better?
Well, it's too early to say, and quite frankly, we know that up to almost a quarter of all patients with COVID infection can develop long COVID over the long run, and the myriad of symptoms, as Ms. McRae said, are vast, and so it's going to be important to mask, test, boost, because not only do we want to prevent current infections, but we want to prevent the development of these long COVID symptoms in the next coming year.
So let's talk about vaccines, Dr. Camino. The numbers are starting to decline with, the amount of people that are taking vaccines. What do we need to be doing to, get more people to take vaccines?
Well, that's a very good point, Sandy. As it is right now in Florida, I think we have about 3/4 of our population who has at least received a single dose of a vaccine. Unfortunately, when we start talking about certain populations, including African American population, that number drops a lot lower to about 44% have received their first initial dose of a vaccine. So, number one, there still remains a lot of work to be done to continue making sure that our population across the state, in our communities, are completely vaccinated. We have large areas of under-vaccinated populations, specifically our African Americans, our non-white Hispanic populations, and while our numbers in vaccinations are improving, we still have a long way to go. And the second point is we know that throughout the last couple of years, the pandemic has disproportionately affected these very same communities, when specifically our African American and our non-white Latino populations were disproportionately affected by COVID, and therefore it's important to make sure that we continue to reach out to those communities in our local cities, in our local counties, to make sure that that vaccination rate continues to increase to the level where it needs to be. I think everyone agrees that the vaccines have been safe, they have been effective, and quite frankly, we are now at the point where not only are we promoting vaccines, but we're on to boosters. And as you know, boosters are a big part of enhancing our immunity because there is no permanent security, there's no permanent immunity, so to speak, from COVID. And so unfortunately for many people, it's important to continue to stay not only vaccinated, but boosted.
Yes, and I want to continue the thought of Dr. Kitonga. So the numbers also are even worse for the boosting population. Only 28% to 30% of the population is boosted. So, and then we know that helps, getting the booster. So unfortunately, the vaccines do not last forever. So we recommend usually after the first 4 to 6 months, people should get their booster. So at this point, for certain part of the population, certain segment of the population, we recommend a second booster, depending on the vaccine. And more importantly, as we alluded earlier, with the new variants, for instance, that B4, B5 variant, the concern is those vaccines may not be as sufficient. So it's very important that people get protected now so that they can protect themselves against the new variants to prevent more variants to come forward. And as a matter of fact, we're talking about in November to have like a polyvalent vaccine that take into consideration the initial strain plus the new Omicron variants. So that new vaccine, hopefully that will come around by the end of the year, will actually vaccinate not only against the original strain, but also the Omicron virus. So there is a lot of potentials coming forward, but also there is still a lot of work to be done in terms of vaccinating people, getting them boosted.
When you say there's a certain area of the population that you would want to be boosted, a second booster. Let's talk a little bit about that. Explain that a little bit more, because I'm interested in that.
So we are recommending that definitely the older population, 50 and above, and also people with a lot of comorbidities, including high blood pressure, diabetes, cancer patients, that those people get the second booster. They get in line first to get the second booster. Obviously, as we have more data, I'm obviously going to also encourage other people, but the first groups that we are really concerned about are the older and then the people with a lot of comorbidities.
Also including that transplant recipients, liver, kidney, definitely need to get boosted.
Yes.
That's important as well.
Yes,
And why is that?
because their immune system is already weak. So the immunities don't last long in their system. So you want to make sure it's boosted to get the antibodies.
So do we need to change the message in terms of trying to get people to get vaccinated and get boosted and mask up? What do we need to do?
Keep educating through social media. You have TikTok, you have Instagram, you have Facebook. What else do you have?
Yeah, all the platforms in social
LinkedIn.
media.
Yep, LinkedIn.
YouTube.
Exactly,
YouTube.
YouTube. You can even maybe reach out some of our rappers or some singers or someone to get the message out more. That way you can engage your younger crowd through message through that way.
Because a lot of the younger crowd doesn't think that they should be taking vaccines either. Are you seeing that a lot in your practice?
Correct,
Yes.
correct. And I think, she's right. It would be helpful if we had local celebrities, who would advocate for the vaccinations of our younger adults, because, it's important to remember that, what affects you affects your family and your friends around you. And we want to prevent people from coming down with COVID and long hauler syndrome, down the line.
Yeah, I think also I wanted to continue your thought. Celebrities, I think, is very important. Role model are very important. Professional players also are very important
Yes.
because our youth relates a lot more to them than to us. I think we, as physicians, we've been more focused on the older and the very young, but I think the generation in between, I think they want somebody they can relate to tell them the message.
Parents that are concerned about vaccinating their kids, what do you say? I know I personally, called you when it was time to vaccinate my kids. I mean, I picked up the phone and said, hey, Dr. Camino, do I vaccinate my 16-year-old daughter?
Right,
and he's
right.
like, yep. So
Absolutely.
what do you say to parents?
Well, we continue to emphasize that the vaccines are safe and effective. And we know this because, we've just received emergency use authorization again now for children as young as 6 months all the way up to 5 years. And so we know that it works. It's important for people to remember that, we want to keep family and friends safe. And the best way to do that is by making sure we vaccinate as many people as possible.
This was a wonderful discussion. Final thoughts?
Yes, continue to wear your mask. Remember, don't be ashamed to be mask shamed. Keep your mask on, whether you're on a plane, train, or a bus. Keep that mask on.
And I'd like to say that it's important to know your status. Get tested at every opportunity that you feel is necessary. If you feel you've been exposed, get tested. If you feel that there's a possibility that you may have been infected, get tested. And remember that there is nothing wrong in going to get a test at any time.
All right. And then I would like to conclude by saying that it's important to get vaccinated. I think most of the advances that we made with controlling the virus has been done to all those steps, but also vaccine is very important. Now more than ever, we have enough data to know that the vaccines are safe, they are efficacious. So keep posted, keep reading, and then keep getting vaccinated.
Doctors, nurse practitioners, thank you guys for joining me. I had a wonderful time. I want to personally thank you for everybody in the community for everything that you guys are doing to help to keep all of us safe. If you want to learn more about the T. Leroy Jefferson Medical Society, just log on to tljmedicalsociety.org. We want to say a special thank you to the Health Council of Southeast Florida for providing the funding to make this program possible. I'm Sandy Collier. We'll see you again next time.